Good morning. Morning of surgery, 5 a.m. I'm very disappointed in Miami Valley South scheduling at Miami Valley. They did not call me. They were supposed to call me after 1 p.m. yesterday, and they did not call me. It was 25 after 5. So I called them, and thank God I accidentally hit the wrong scheduling button, and the girl that answered from the mammogram scheduling was able to answer me because she has access to, all the records and everything. So she gave me my time and everything. She goes, but I don't have your restrictions. I says, well, they went over all that at my pre-op appointment, and I have all the paperwork. And she goes, okay, well, this is what we got scheduled for you. And so 9:15 is my surgery. I have to be there at 7:15. It's 5 o'clock in the morning. I just drank my electrolytes, which I could have. They said Gatorade, water, and black coffee before 7. Wow, my eyes are all puffy. I went trick-or-treating last night with the kids, and I ate a little chocolate bar. And I can feel it this morning, my hands and stuff. So, all right, I will not be posting this. I'm going to try and take some pictures and video while I'm at the hospital and when I get home, and then I will post all this. All right, cheers. Okay, getting ready. Doctor's running 30 minutes late. Dang it, that's how my week's been running. All right, well, here we go.
Okay.
Well, good morning, day 2, 48 hours after surgery. My nausea is pretty much subsided a little bit. I'm still getting, when I eat, it's really weird. I get the hiccups and then get really bad indigestion. So, but they didn't put the tube down my throat. They just knocked me out and gave me an epidural and everything. I'll show you. I got the ice machine on my leg and everything. So I've got my wedge up here, so I'm doing good that way. And I got my compression sock on my other leg. So doing good that way. I was a little disappointed with Miami Valley South. It was like they were rushing me out of there. I could not hardly keep my eyes open. I did my therapies, and to where, I could walk down to the bathroom. I walked up the steps, walked down the steps. So then they're like, okay, she's good to go. Send her on her way. And I'm like, I couldn't even keep my eyes open. And I just felt like it was a rush. My doctor did amazing. I just, they just wanted me out of there. I don't know what's going on, but anyway, kind of sucked. Anyway, then we got back here. Last night was not last night, the night before. The first night was rough. Last night was pretty good. I've got a little pillow under my butt where they gave me the epidural, and my surgery side, like sciatica, is kind of bothering me. So I put that pillow there, and that's doing much better. Alrighty. All right, she's back in from the barn. All right. Say hi, Carol. It's video for my log of my surgery. Okay. Bye. All right. Good morning. It's day 4. Okay. I thought I would do my workout with you guys. I haven't had my Ozempic. This will be week 3, and they don't want me to have it because they don't know how it will help with healing. So I haven't had it, but I haven't had that appetite. I was very nauseous the first few days after surgery, and I get that way with anesthesia. They did not put the thing down my throat or anything like that. So I'm feeling pretty good. I'm still very sleepy. Which it's only day 4, which I'm going to be sleepy. Plus I'm taking the meds and everything. So I went ahead and I went to the bathroom, and I took my wedge off, and I'm going to go ahead and do my workout with you guys that I have to do 3 times a day for my knee surgery. Let me just maneuver some stuff around here, and you can see I've got my pile of stuff here, my pillows, my blankets. This is my everything here. If you go this way, here's my ice machine is here. Right here, I got my bag of pills. Everything is in my little bag, all my medications. I've got my drink here. I've got my castor oil. I have been putting on everything, and I've just been trying to have everything within hand's reach, because when I get up, I can only get up for 10 minutes at a time. All right, I'm gonna try and get that. Let me go back just a little bit. Sorry, this is hard, not being able to get up and move around. All right, and when I went to weigh in at the hospital, I was down to 186, but with all my clothes on at the hospital, I was 191, and that's with my shoes on too. So I was like, okay, I'll take that, you know it, and everything. So what I gotta do is, I'm gonna try and sit back a little bit, okay. All right, and this is my ice machine stuff. It's the compression. It's got 2 bands on it, and I put that on, and well, I'm taking it off now and everything. And if you don't like to see weird, gross stuff, so you're gonna see my owie. Okay, I do have gauze on it right now, but what I've been doing is massaging oil around it. And then this is an old tea towel, because they want you to use a pillowcase. Put that there. They want you to use a pillowcase, and I was like, man, I'd have to go upstairs and get a pillowcase. And what I had was this, and this works perfect because it's super thin. You know, you put it over like if you're making sourdough bread, and I can feel the cold through there and everything. So maybe I'll leave the bandage on. I just have this bandage on here lightly. It's gonna pop off. Okay. All right. So, and then I'll get a fresh one. I've got all that over here too. So I don't know if you can see, they stapled it this time. This one they glued. This one they glued. This one they've got stapled. So what I've been doing is rubbing the coat up, and they had to put a tourniquet on. Okay, they had to put a tourniquet on. I don't know. Can you see the indent in my leg right here? See the little chub here? And then there's an indent. They had to put a tourniquet on. They said I was a bleeder. And this little dot right here, I don't know if you can see it, that's where they put the nerve block in. And they gave me a shot, and that's when they said, yep, she's a bleeder. So they were prepared for me to get the tourniquet in. All right, so, but that's there. Yeah, I still have the little lines on there from the surgery. So, and this is, I'm gonna have to put the thing up, so hopefully you can see okay. Now this thing I've been using regularly. They give you this at the hospital. I use this to put under my foot, and I can use it for my leg. Okay, so I'm gonna put this up because you're supposed to do this in a sitting position. All right, and then you'll see I've got, okay, let me scoot back a little. Okay, so this leg, you see I've got a compression sock on, and then this leg I don't. I'm surprised they didn't give me like a partial one. So the first exercise I'm gonna do is I'm gonna pick this up and drop this knee. And let me see if I can, you know what, let me move the camera just a little bit. This is giving me a workout too, just doing this, all right? All right. Let me just move it. Yeah, that way you can see my foot better, okay? Okay. Okay. All right, and then I found out yesterday they don't want to, my insurance only covers so much, or, oops, there, okay, this is electric, see. Okay, for in-home therapy, they can't find somebody to come out here that will be covered by my insurance. So what I'm gonna do is, this is the first exercise, I'm just gonna pick up my foot and drop my knee. And what I'm doing is dropping and straightening my knee, okay? Because that's one thing that is hard. You want to be able to have like the flexibility. Okay, so that's one. I have to do 10 of these. 2, 3, and I hold it for a few seconds. And when I stand up, I always straighten my leg up with the walker. 6, 7, 8, 9, 10. I'm gonna hold this one for a few seconds. This one doesn't hurt bad, okay? This next one's going to hurt. Okay, this is a heel slide, and they suggest across your things, okay? And this is to get your flexibility. I'm going to try and get my knee as close as I can to my chest. And this is going to help. I'm going to get as far as I can, and I have to breathe like I'm having a baby because it freaking hurts, okay? And this is the one that a lot of people cheat on, and you don't want to cheat on this one because this is the one that's going to give you the flexibility when later, when you're done, you know what I mean? You're going to be able to do things and not have that limp anymore and stuff like that. Now, my knee was collapsed on the inside and my tibia was poking out, and my shin feels like I was walking up concrete stairs and I slipped and I scraped my knee, and that's what it feels like inside on the front of my shin. And then I can feel pain like right here on the inside, and you can see there's some bruising there. So I know he had to straighten that out. He talked to Matt after surgery. I didn't get to talk to him, so I know. Now this one, I'm only doing 5 because I'm lucky to get through 5. I will work on getting up to 10. And since it's only day 4, they even say not even to start therapy till 48 hours after, but they had me start it right away. And they did last time too, and I agree. You should start it right away. So I'm just, if I can get 5 in, I'm going to get 5 in. All right, so I'm going to go ahead and pull up. And then when I get as far as I can get it, I try to go a little bit more, and hold it for a sec. And then put it down. And that's 1. And then I usually straighten it out. Okay, I just do that because why not, you know? Okay, so, and 2. Okay, and straighten it out. And 3. And 4. And I know, yes, my knee looks like there's a caterpillar on it. It's so weird looking. This one they glued. It was flat, so it just looks so weird stitched. And I had the robotic, so. Okay, 1 more of these. Tomorrow I think I might go for 6 because I am getting, I think, a good flex on this, okay. Straighten it out. And then you can always push your knee down too to make sure, but I can feel it go straight. All right, and then underneath all my blankets in my pillow here, I've got this is for my first surgery. They don't give you these anymore. This is a rolled up blanket. And I kind of cheat on this one because I can't hardly pick my quad up. So I use my thing, and this goes under your knee. Now I've and you put your heel down, and then you're going to want to use your quadricep, but they want you to take and just pull up. They want you to just lift, and with the way things are, I can't do that. I watched YouTube videos on the therapy, and they were like, just put a wash rag or a towel under there and just lift your leg. And I'm just like, well, that would be easier. But this is what they showed me at the hospital. Okay, so I'm gonna use this because I'm cheating. But I'm gonna tighten this when I do it. So I'm gonna go up and I'm gonna tighten here. Oh, yeah, okay, and hold it up as high as I can and tighten all this. I got this tight. I'm gonna do 10 of these. Okay, 1, 2, 3, 4, nice and tight, and it hurts all the way down, I'm telling you. 5, I can feel my incision. My knee inside feels fine. It's the incision hurts. 6, 7, and I might try a wash rag underneath or a towel under there just to 8, 9, and 10. And I'm gonna hold this for a second and really tighten this as much as I can, because this is a big muscle. You want to get this muscle big. Okay, so I'm gonna hold this up. Now I roll this to my ankle. Okay, and then I just lift my foot and push this down. 1, oh, and then 2, 3, 4, and this is actually helping this too. 5, 2. Oh, you like how I cheated there? 2 to 5. 3, 4, 5, 6, 7, 8, 9, and 10. And then I'm gonna hold that for a few seconds. And that is my workout for right now. And then I'm allowed to do the stairs once a day. I didn't do them at all yesterday, but I'm gonna get a shower today, and Carol's coming over. And since I'm still unstable, and see, I use this to lift my leg, and then I stash this back under here because I'll use this. I have everything here. I do have people coming and going and checking on me. Matt stayed with me the first day after I got home, and then Carol came Sunday. But I'm pretty independent, so I've been able to do my things myself. So and this ice machine's good to put stuff on. So I've been pretty much taking care of myself. And then Kay, my landlord, has been totally amazing. Has been making me dinners and lunch, and she's made me chicken soup and vegetable soup. And okay, I have to scoot slow. Okay, and okay, I can take this off. Then and she made me some chicken Brussels sprouts, sweet potatoes, craisins, like a roast, a vegetable roast, and then she made pot roast last night, and it was amazing. All right, so I love it. It's been great. All right, well, that is my rehab routine on day 4 so far, and I'm doing that 3 times a day. And hopefully they get me somebody that can come help me here at the house to see if there's more things I need to do. I know I will start, I will go to rehab after 2 weeks. My next doctor's appointment is not till the 20th, I think, to get the staples out. So I don't I know after 2 weeks they're going to want me to ride an in Cumberland bike and just to get that movement going and stuff like that. So the flexibility in there, and then the ice machine, I keep this ice machine on always. And then this is the wedge that we have. I put my leg in, so I have got it propped up and iced 90% of the time. The only time I don't is when I'm working out or taking a shower, going to the bathroom. And when I take this off, take everything off, then I go to the bathroom, do my stuff, and come right back, put it all back on, and then hook back up and chill out, all right, and heal. All right, have an amazing day, and more to come. Love you guys. Oh, I forgot to tell you. Oh, and I moved the camera. Okay, so what been doing with the castor oil, this was all, I had broken blood vessels from the tourniquet, and you can see where it just indented it. So, and it hurts. Hurt. So I'm taking castor oil and not getting it near this incision, but I'm massaging it in, because castor oil helps with inflammation. And getting behind my knee was really swelled up that first day. And with the towel, the tea towel is really good because it's a nice organic cotton tea towel. And so, and you know, this is really thick. So, you know, you don't need a lot, but I'm using a lot. And I'm just rubbing it on the sides and just behind my knee, and yeah, getting it in there, just trying to, and I think it's helping the blood circulation and just everything. If nothing else, it feels good, you know. And I like castor oil. Castor oil is amazing. I just really like it. I just go, you know, you don't see I'm going next to I'm not getting right on my stitches there, you know it. So, and then you can see this was all bruised. I had broken blood vessels all here, and they're already clearing up. So I'm pretty sure that's the castor oil. Then all the extra, I rub on this leg. All right. Yes, me and my castor oil. Love it. Yeah. All right, I'm gonna get a shower later, so I'm not gonna do my beauty stuff till later. Do my little exercises to firm up my face and all that stuff. Okay. All right. Healing. Here we go. Okay, so I thought I'd show you how I just put gauze back on there and put my tea towel. Okay, and I'll put that like that. I know you can't. Let me lower you a little bit. Oops. Sorry, I'm not very. Where is my thing? There it is. Sorry. So you can get a better view. Can you see that okay? No. All right, well, you get the gist of it. Okay, and then I'll get my tea towel on there. And then I got my thing, and it goes like this on, like this. You want it down, so the hoses are down, and I just wrap it around. And you just want it snug. You don't want it too tight. You just want a nice light compression. If you get it too tight, it will bother you, you know. So, and this top one is a little bit more. Okay. And you don't have to have your leg up in the wedge all the time. You can take a break from it. But I kind of like it. I like the elevation, you know, so. All right, so I got that hooked up, and then, sorry, and then I just got this, where I hook it to the bottom of this, and this is the water, the ice water goes through there, and then I just turn it on. I've got the plug, and you just plug it back in, and right here. And what Matt does is he packs this with ice before he goes to work and a little bit of water. And this will last until about 1 o'clock. And then Carol comes and she'll pack it again. And then when Matt gets home from work, it will be ready for another packing before I go to sleep. And so, ooh, nice and cold. Yeah. All right. So then what I do too is when I go to get in the wedge, all right, I have to use my hands to get up. So, okay. And then I go up like this. And then I put the wedge behind me. And I line up my leg. I don't know if can you see this okay? All right, see they got the wedge here? And I got my heel lined up. And then I'm gonna sit back down in the chair, and this is an auto chair. So, and then I just kind of go like this. And I've got it, see, I got the wedge already lined up. And then I like to take this, because if I have to adjust while I'm laying here, I have this already. So I'll put this off to the side and it's on my foot. And then I just go like this. I'm just gonna show you real quick, and see, and then I just pick up in the auto chair. Yay! All right, and then I just chill out. I haven't been binge watching anything yet. I've been trying not to turn the TV on till after noon and stuff like that, so I don't get in the habit of just binging everything. Okay. And this is getting nice and cold. And after that little bit of a workout, it's funny, just that little bit of a workout, I get warm. And I know it's the medication too. So, but I just, it's like, whew, that was a workout. Whew. That's nothing, right? Okay. All right. Well, I'm going to take off for now, and to be continued.